this is all about the patients. We're gonna take some time.
Sorry, I just wanted to address the fact that that gentleman said that it's better to darken the skin than for a my color person. It's a preference thing because it's a preference thing because I've had radiotherapy and it went so dark that I hated it. It didn't fade.
Okay. It's okay.
Well, it didn't fade. That's the point.
It's okay. Yeah. Okay. All right. Okay. All right. We're going to move on. We'll move on. Okay. Okay. So we're gonna move on. I think in the program. So just to reintroduce myself, I'm Lamont. I'm a facial plastic researcher, and I've been doing keloid research now since 2011, and with the increase and change in technology, I've tried to learn more and advance some of the things that I do, and I think part of this talk, even though the talk is about surgery, I think Michael always puts me in the surgeon category, but what I'm interested in is how do we move this disease forward? How do we unite each other? And I think one of the things is using technology is going to be important regardless of how you treat it. Yesterday we talked about how sometimes it's hard to tell whether or not something is a keloid, and so then for researchers, it's hard for us to just synchronize and increase in scale because there's some different understanding of what keloids are. So what I've done, and I'm in the testing phase, is I had this concept about an app called Keloid Scan AI. Okay, and the way I envision this, it's going to be multiple stages. And so my wife is a family practice physician. And so when I told her one day that I had this idea about an app, she said, she wanted to caution me a little bit that, in primary care, they have apps for like diabetes. And she was like, patients don't use the apps. And so what I want to do is just get some feedback. I'm going to introduce the concept. I want to get some feedback about the idea so that as I go through the development stage, I can perfect it and make it as useful as possible. So when we look at keloid disease, I mean, there's really three main perspectives. There's the patient perspective, there are the clinician perspective, then there's the researchers or the biopharma who are interested in advancing our understanding of the disease. And part of the problem is that we don't really have a real quantitative way to follow the patient experience in between visits, so that we can use that information as productively as possible. And so one of the things is we look at the tools. So we talk about the Vancouver scale. We talk about the patient observer scar assessment scale. Those scales were originally not designed for keloid disease, and so for some of the things that we do, I mean, they're perfectly imperfect, meaning that they have some limitations. And one of the things that I was part of was a group a few years ago, and we came up with the Detroit Keloid Scale, which is better in that it was validated in keloid patients, but there's still some limitations when you have the patient observer and the provider observer. And so what it can't do is it doesn't do well capture data in between visits, having a longitudinal, something that's easy to track multiple points. When you talk to patients, there are a lot of things that we know that go into disease. Frank is really big into wellness, and so we know diet causes flares. And sometimes when we treat the patient, it's not just about removing the disease, because sometimes it's difficult to do. And for some patients, just controlling the symptoms are important. So being able to track triggers, And when a patient comes to see, one of us as keloid experts, a lot of times they see multiple providers. It's hard for them to, convey all of the treatments that they have. And again, we talked about this before, the whole thing about uniting around a registry. It's just hard to scale this disease so that we can get the information that's necessary to move things forward. So technology can be useful. And the concept, what I've started is to create a web-based app that will allow patients to track their experience, to make it structured, HIPAA-compliant data that then can be used by providers and researchers to move things forward. And eventually it'll be obviously cloud-based and secured. So what is the idea of KeloidScan AI? It's a web-based a program, mobile program that will hopefully be able to provide the information that us as clinicians and researchers need, and also be a tool for patients to help them manage their disease. So the way it's set up, we talked about this before. All the keloids are different. Right now, we kind of group the experience into one, but all the keloids don't necessarily all react or function the same. So one keloid, one record, one story. The way it's set up, patients could access it through a web-based link. They'll be able to register. It's really the way I designed it. It's with the patient flow in mind. There'll be a body map. Patients will be able to click on it, enter the keloid, and there'll be background information that they'll be able to put in, onset, treatment they've had. They'll be able to upload a picture into the program, and then there'll be a daily log, weekly log for symptoms, and then there'll be an opportunity for them to track whatever treatments that they're getting. So this is sort of the setup and the flow. I think that what I'll just move straight to is, so this is some of the concept around how it's set. This is all technical, but let's just move to what it looks like. So, again, patients will be able to upload the pictures. There'll be a symptom section. There'll be a section for treatment. And the whole idea will be that they'll be able to send this report to their provider. So if they go see a new physician, they'll have a report to be able to be created. So again, some of it is helping the patient with their experience. So, is it the treatment that's failed? Sometimes it's difficult to adhere to the treatment plan. And so this app will help patients be able to, log their experience and their treatment. So what I want everybody to do, you have your phone, if you could, scan the QR code and pull up the app. And when you go to the app, there'll be there'll be a landing page. You click on it. It'll already have a couple keloids that have been logged, but then you can then go and do the add a keloid. Anybody have a problem? Is it loading okay? Okay. Yeah, we'll leave this here. Okay. So pulled up, are you able to click the get started? Okay, so you click the get started. So you'll see there's a few keloids that have already been logged. And you can go to those and you can see how, you're able to track symptoms on a daily basis. And then you can even go to the add a keloid. So you can see it set up. It has, there's a few little glitches I'm working on, but you can click like on the head or the abdomen, and you'll see it allow you to add a keloid, and then it has the symptoms. You can say whether or not you want to track treatment. And so the whole idea of this is, again, to allow us to rally around some type of structured data acquisition. We've talked about keloids being more than just a local disease. It's a systemic disease. And so you can figure out what your triggers are. We talked about low inflammatory diets, temperature. We know patients sometimes have issues with temperature. So the whole idea is to create a way for patients to track their experience and for providers then to use that information to help propel science and innovation. Any issues with using it? Yes, question?
Yes, Jay?
Yeah. So this is just a beta, so you can't put your information. It's not live yet. This is a self-contained link that just gives you the experience. Yeah. So if you go to add a keloid, you can see. Then you click.
Right.
Yeah. Is it, anybody having any problems clicking through? So so the whole idea this is going to be done in phases. So this is the first phase. What I'm really trying to figure out is from the patient experience, whether or not this will be something that's useful. My plan is sometime later this month or the beginning of July is to send out a link where people can sort of click through, have more of a personal experience with it, and then I can get some feedback to see what the demand may be, the interest. I'm looking for input, from patients and users. I want to make it as user-friendly as possible, and to make sure we're not leaving out any important features in the beginning. And then in phase two, it's really to kind of synchronize with providers and researchers to see, how this potentially could help with your practice. Obviously, at some point, we'll have this so that it's available for research, and then eventually have it so that it's incorporated into medical records. One of the things that I'll just give you an example of what I plan to do. I plan to also use AI. So one of the things that we're working on in the background is you can use the phone to take 3D a picture of the keloid, and so that it can automatically follow the change in keloid from a volume standpoint. So we know that technology is already there. The other thing that I'm interested in doing, I do a lot of biomarker research. And so one of the things that we're interested in is correlating the physical structure of the keloid to the molecular signature. So, we have a lot of biological data, and there's somebody that at my institution that's really good on using I'm blanking on the exact term, but basically you can take the physical appearance and then correlate that with molecular. And when you combine patient information, so your ethnicity, whether or not you have a family history, how many keloids you have, you can predict recurrence. And the goal will be at some point to have AI to predict recurrence for treatment, to give some recommendation on treatments potentially, and also things that can help with symptoms. So those are some of the things that I think may be useful for this. I'd love to get some feedback to see what other people may think is important. And again, this is going to be a phased approach. So what's needed is feedback from patients, feedback from other clinicians and researchers. Again, I will reach out to the group once the website is live so that people can try it and provide feedback. So again, the whole idea for this is to be patient focused. I look at this as a potential a network creator, so that we can interact from the patient standpoint, from clinician and researchers in order to move this forward. And again, this won't necessarily be just for surgical patients. This could be for any treatment modality. So that's the end of the presentation. I'm a little early. I don't know if whoever's next, if there's any questions, I'm happy to entertain them.
Lamont?
Yes.
I'm going to try. Oh, it works. So I'm curious about the research angle, obviously. So you're going to link this with the medical record. So I'm just wondering how, if a patient is downloading this and is using it to track the history of their keloid, will they be entering the, the treatment data, or, I'm just thinking from like an IRB perspective.
Right.
Does the patient have to consent additionally to have their medical record linked with their data, or how's that going to work?
So I would imagine that it has to be HIPAA compliant. There are other examples where people are using, like a Wi-Fi connected scale. So, my plan would be to follow whatever process that's already out there. I think you're right. I mean, we'll probably have to figure out whose data is going to be, the source of truth, for example, for treatment. And those are all great questions that, as we move through this sort of a process, we'll be able to figure out what's best.
Lamont, can you hear me?
Yes.
Okay. Lamont, you're a professor, full of ideas. Who on earth's going to fill all this in? Who's got time to fill it all in, unless you've got a team like a professor?
So that's exactly it, and that's what my wife warned me about, about the app. And so
These
part of
poor people, they can't afford all this. That you can't sit for an hour with them going through a script thing like that. If you photograph it, stick it in the notes, and then you've got a copy. Lamont is far too complicated.
So if you look at the interaction, the whole idea about the interaction on the front end, the patient sensing. The way I imagine it, it'll be maybe a couple extra steps. So you have to log it.
Steps.
Yeah. Well, but that's part of the reason why I'm doing this, to get feedback, to try to see whether or not
Well, you're an innovator,
Yeah.
and I congratulate you. And it's a good idea, but it's too complex. Imagine me doing that on my own.
Yeah. So
John, I mean, this is the beginning of what is similar to cancer registries. It is tedious. It must be done. We need to have a registry for keloid patients, as we do have for cancer patients. Cancer registries are everywhere. Tons of time, money, effort goes into that. This is the beginning of that. So this must be done.
And a good thing, John, is that most of the patients that get this are a lot younger than us. So I don't think it's going to be as difficult. Any other questions?
Hi, Lamont. It's more of a comment than a question. You put AI in there, and there's a lot of opportunity to use AI for good, such that a photograph can be uploaded and it can automatically fill in the data set.
Correct.
And so it actually doesn't have to be onerous on the individual. And you can use a lot of the AI strategies now, incorporated wisely, can actually make this really fly. So I think that's an excellent idea, but it just needs kind of the firepower behind it.
Yeah. So that
data perspective.
Yeah, that's a great perspective, and that's the goal. But you got to start. You got to start somewhere. So,
thank you very much. That's an excellent effort that you're doing, Ramon. Let's move on with the presentations. Go ahead, Thomas.
Yes, thank you.